Hey guys, it's Katie from 4 Patriots, and today I'm going to talk to you about something most people probably learned at some point, but may have forgotten about by now. CPR. What does CPR stand for? Cardiopulmonary resuscitation. It's a mouthful to say, but it's a life-saving technique that is very useful in many emergency situations. In fact, it's so useful that immediate CPR can double, even triple someone's chances for survival. So word to the wise, pay attention, because you never know when you're gonna need it. Now I realize performing CPR can be a scary thought. In fact, most people are reluctant to even attempt it. It can be a little up close and personal. That's why we decided to bring in the pros from CPR Choice. Cheryl with CPR Choice is going to teach us the skills necessary to overcome any reluctance we might have, and instead take action during emergency situations. Before we get to that, be sure to hit the subscribe button on this channel and tap that little bell next to it. You'll get notifications each time we post a new video and you won't want to miss out. Now, let's get started.
Okay, great. So just like Katie said, a lot of people are scared to do CPR, and our goal is to try to remove those barriers and make you feel confident. So really, you can do CPR in just knowing 2 easy steps: calling 911 and pushing hard and fast on the center of the chest. Calling 911 is absolutely the most important step, because most of the time when people go down, they are going down because of something serious. It's a heart attack, it's a stroke, it's a cardiac arrest. And guess what? CPR doesn't cure heart attacks and it doesn't cure strokes. It buys you time for 911 to get there. So this is our hands-only CPR, where we're giving CPR to a victim that maybe we don't feel comfortable putting our mouth on their mouth. So before we even do anything though, we always want to make sure that the scene is safe. What does that mean? It means there's nothing that can hurt me, that I'm going to be safe if I approach this victim. As long as the scene is safe, then we're going to tap the victim for responsiveness and we're going to say, hey, are you okay? Are you okay? If he's not okay, at that point, we're going to activate 911. We're going to tell somebody, hey, you, go call 911. Or nowadays, most of us have a cell phone in our pocket. We're going to pull that out and we're going to call 911. Then we're going to check for signs of life by listening, and feeling. We're going to tilt that head back. We're going to look down the plane of the chest, and we're going to see, do we see his chest rising? Do we feel him breathing? Do we hear him breathing? But if there is no response at all, then we're going to immediately move into action with compressions. But we do need to know specifically how to do that. So we're going to use the bony part of our palm, just the heel of our hand, and we're going to place that on the lower portion of the sternum. So I literally want you to visualize if you were to draw an imaginary line right in between the nipples and place our heel of our hand right there below it. And then we're going to interlace the fingers. We're going to keep our elbows straight. We're going to put our shoulders over the victim, and we're going to push directly straight down. One of the reasons that we interlace the fingers is actually to pull the weight off of them. One thing I see a lot of people do is they flatten their hands out and do the compression. That puts our weight all over the hand. So if you do catch your hand kind of slipping off to the side, you could start to hear things crack or crunch. Sometimes ribs break when we do CPR. It doesn't matter, it happens to the best of us. We just want to get our hand right back in the right spot. So we're going to place the heel of our hand on that lower portion of the sternum. We're going to interlace the fingers. We're going to keep our elbows straight, and we're just going to push directly straight down at least 2 inches.
So this compression only is super helpful to know. In a pandemic, I can see how this would be very, very useful. But I know you mentioned kind of the full CPR with breaths, so maybe we could walk through that next.
Absolutely. So 85% of cardiac arrests actually happen at home, and most of us do feel comfortable putting our mouth on the people that we love, right? It's our kids, it's our spouse, it's our grandma. And so we definitely want you guys to know how to do compressions and breaths in that situation. So when we're doing compressions and breaths, our ratio of compressions to breaths is 30-2. Last time we just did continuous compressions until 911 came or until another person came, right? But this time we're actually going to count them, we're going to count out loud, and we're going to count to 30. As soon as we're done with those 30 compressions, we're going to tilt the head back, and we're going to plug the nose, and we're going to place our mouth over the victim's mouth, and we're going to give 2 breaths. Okay, when we give our breaths, we want to make sure that the chest rises. That's how we know that our breaths are actually effective and going in.
Do you change anything for, a 5-year-old victim?
If the child is really small, we can use the palm of one hand instead of the palm of two. And then when we're giving breaths, we're still looking for chest rise, but what you have to remember is that their lungs are a lot smaller, so it doesn't take the same amount of breath. So another thing that is a little bit different with the baby is that we're gonna put our mouth over their nose and mouth when we give the ventilation. So that is a little bit different, but we're just gonna tilt that head back. We're gonna put our mouth over their nose and mouth. And you should just be able to visibly see that chest rise. Just a little tiny puff is enough.
Okay, so how do you know when to stop performing CPR?
So really, once we start CPR, we're not gonna stop until advanced medical care gets there. But if we're in a public access area, we're gonna tell somebody to call 911 and see if they can find an AED. Go get the AED. So it's an automated external defibrillator. I'm gonna start CPR while you're going to get the AED. So I'm doing CPR, you're running to the other side of the building to go get the AED. Here you come. Now, as soon as you come, we're gonna try to get that AED on that chest as quickly as possible. I'm gonna continue doing CPR though. You're gonna work around me until it actually tells us to clear. This one's just a small little trainer, but they all look very similar. There's a green button and a red button. The green button turns it on, the red button delivers the shock. So when we turn the AED on, the very first thing that it's usually going to say is apply pads to patient's bare chest. And luckily for you, the pads have pictures on them. So we're gonna look at the pictures on the pads and we're gonna apply those pads to the patient's bare chest, just like the directions tell us. As soon as we plug it in, it's gonna say analyzing heart rhythm, stay clear of patient. So we're gonna tell everybody, hey, everybody stay clear. And it actually has an internal EKG in it. It's going to read the person's heart rhythm and it's gonna determine if they can get a shock or not.
Okay, and if they have an internal defibrillator, it's gonna detect that?
Yes, if they have a pacemaker or internal defibrillator, then it's going to detect. As long as the pacemaker and the defibrillator is working, then it's probably going to tell you no shock advised. How about if it malfunctioned though? It will light up red and it will tell you to push the shock button. We push the shock button, shock would be delivered, and then we immediately begin CPR, starting back with our compressions. We leave the pads in place. Okay, and about every 2 minutes, the AED will reanalyze if they need additional shocks.
I could imagine that this would be pretty intimidating, having to cut someone's clothes off. How do you encourage people to kind of take that step?
So the good news is that AEDs are literally designed for someone that's never used it before to be able to use it. So let's give that a test and see. So all I want you to do is I want you to turn it on and follow the directions.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Now don't forget, the person's dying, so we want to hustle.
Okay, I can do that.
Apply pads, plug in connector. Analyzing heart rhythm. Do not touch the patient.
So we tell everybody, hey, don't touch him.
Don't touch him.
Shock advised.
So that's when I click the button.
Charging.
Oh, okay.
Stay clear of patient.
Tell everybody clear again. We don't want you to get shocked. Hey.
Deliver shock now. Press the orange button now. Shock delivered. If needed, begin CPR.
So I'm glad that we just had a little crash course on AED. As you can see, they are really easy to use. All of our CPR classes do include how to use an AED. They do go hand in hand, but there's obviously different levels of CPR training, first aid training that can go more in depth, where you can learn more, especially if you're a medical professional and so forth.
Right. Okay, well, yeah, I'm glad I know how to use that now because I definitely did not before this moment. Thank you so much, Cheryl, for walking us through this. This is absolutely good to know. So did you learn anything in this video? Did you already know CPR? Maybe it was a good refresher. Let us know in the comments, along with any other kind of survival topics that you'd like us to cover. And don't forget to subscribe to our channel while you're down there. Thanks for watching.